Hello everyone and welcome back to our channel. Today, we're going to talk about a common and often uncomfortable health issue that affects many people, urinary tract infections, or UTIs. What is UTI? But before we dive into the details, let's understand what exactly a UTI is. A UTI, or urinary tract infection, is an infection that occurs in any part of the urinary system, which includes the kidneys, bladder, ureters, and urethra. It is usually caused by bacteria, most commonly Escherichia coli, E.coli, entering the urinary tract and multiplying, leading to an infection. Brief history of UTI. The earliest known references to urinary tract infection and their treatments can be found in ancient Egyptian, Greek, and Roman medical texts. In ancient Egypt, medical papyri from around 1500 BCE described symptoms and treatments for what are believed to be UTIs. Around 400 BCE, Greek physician Hippocrates, often referred to as the father of medicine, recognized urinary symptoms as signs of disease. During the 19th century, scientists such as Louis Pasteur and Robert Koch highlighted the role of bacteria in infections. With advanced laboratory techniques in the 20th century, researchers could identify specific bacteria responsible for UTIs. Identification of specific bacteria associated with UTI led to the development of targeted antibiotic therapies to combat UTIs effectively. Today, UTIs are a well-recognized and common medical condition. Extensive research has expanded our knowledge of UTIs, their causes, risk factors, and treatment options. What are the causal agents of UTI? The most common causal agent of urinary tract infections is bacteria. Among the different types of bacteria, Escherichia coli is the primary culprit, responsible for about 80 to 90% of all UTIs. E. coli is a normal part of the intestinal flora and can enter the urinary tract through the urethra. Other bacteria that can cause UTIs include Staphylococcus saprophyticus, Klebsiella pneumoniae, Proteus mirabilis, and Enterococcus faecalis. It's important to note that UTIs can also be caused by other microorganisms, such as viruses and fungi, but these cases are relatively rare as compared to bacterial infections. How UTI transmits. The most common mode of transmission of UTI is from the individual's own gastrointestinal tract, where bacteria naturally reside, to the urinary tract. Here are some ways UTIs can be transmitted. Ascending infection. This is the most common route of transmission for UTIs, especially in women. Bacteria from the perineal area can enter the urethra and migrate up to the bladder, causing an infection. This can occur due to improper wiping after using the toilet, which allows bacteria to reach the urethra. Sexual activity can also contribute to the transmission of bacteria from the genital area to the urinary tract. Hematogenous spread. In rare cases, bacteria can spread to the urinary tract through the bloodstream. This typically occurs when an individual has a severe systemic infection, such as a kidney infection, and the bacteria travel from other infected sites to the kidneys or bladder via the bloodstream. Medical procedures. UTIs can be transmitted during medical procedures, such as urinary catheterization, cystoscopy, or urological surgeries. These procedures introduce bacteria into the urinary tract, increasing the risk of infection. Structural abnormalities. Some individuals may have anatomical or structural abnormalities in their urinary tract, making them more susceptible to UTIs. These abnormalities can hinder the proper flow of urine or create pockets where bacteria can accumulate, leading to recurrent infections. It's worth noting that UTIs are not considered contagious as it does not easily spread from person to person through casual contact or respiratory droplets. Pathogenicity of UTI. The pathogenicity of urinary tract infections refers to the ability of the causative bacteria to cause disease and produce symptoms in the urinary tract, which include adhesion and colonization. UTI-causing bacteria possess adhesins, which are specialized molecules that enable them to adhere to the cells lining the urinary tract. These adhesins bind to specific receptors on the surface of uroepithelial cells, allowing the bacteria to establish colonization in the urinary tract, which enable bacteria to resist urinary flow and prevent their clearance during urination. Invasion and evasion. Once the bacteria adhere to the urinary tract lining, they can invade the epithelial cells or form biofilms. Intracellular invasion allows the bacteria to evade the immune system and antibiotic treatment, leading to persistent or recurrent infections. Biofilms provide a protective environment for bacteria, making them more resistant to immune defenses and antibiotics. Toxins and virulence factors. UTI-causing bacteria produce various toxins and virulence factors that contribute to the pathogenicity of the infection. These factors can damage the host tissues, impair the immune response, and aid in the survival and proliferation of the bacteria. Immune evasion. UTI-causing bacteria have mechanisms to evade the immune system's response. They can produce proteins or molecules that interfere with host immune defenses, such as inhibiting phagocytosis or modulating the production of inflammatory cytokines. These strategies allow the bacteria to establish persistent infections and evade immune clearance. What are the symptoms of UTI? Urinary tract infections can cause a range of symptoms that vary in severity and presentation. Here are some common symptoms associated with UTIs. Frequent urination. An increased urge to urinate more frequently than usual is a common symptom of UTIs. The person may feel the need to urinate shortly after emptying their bladder. Pain or burning sensation. A burning sensation or pain during urination, known as dysuria, is a hallmark symptom of UTIs. It can range from mild discomfort to intense pain. Urgency. The feeling of needing to urinate urgently is often experienced with UTIs. The individual may find it challenging to hold their urine for long periods. Lower abdominal or pelvic pain. UTIs can cause pain or discomfort in the lower abdomen or pelvic region. This pain may be dull, achy, or cramp-like. Cloudy or bloody urine. UTIs can cause changes in the appearance of urine. The urine may appear cloudy, have a strong odor, or contain traces of blood, giving it a pink or reddish color. Strong-smelling urine. UTIs can cause urine to have a stronger and more pungent odor than usual. Fatigue and general malaise. In some cases, UTIs may lead to a feeling of general fatigue or malaise. This can be attributed to the body's immune response to the infection. How to diagnose UTI? Here are the common steps involved in diagnosing a UTI, which include clinical symptoms. The healthcare professional will ask medical history and inquire about urinary symptoms such as frequency, urgency, dysuria, painful urination, and any other associated discomfort. Physical examination. A physical examination may be conducted to check for signs of infection, such as tenderness or pain in the lower abdomen or back. In some cases, a pelvic examination may be performed in women to assess the reproductive organs. Urinalysis. A urinalysis is a standard initial test for UTIs. A urine sample is collected and analyzed for the presence of bacteria, WBCs, RBCs, and other abnormalities. A positive result for bacteria and/or white blood cells in the urine, along with clinical symptoms, suggests a UTI. Urine culture. If the urinalysis indicates the presence of bacteria, a urine culture may be performed. This test helps identify the specific bacteria causing the infection and determines which antibiotics will be effective in treating it. Imaging tests. In certain situations, like recurrent UTIs or signs of more severe infection, imaging tests like ultrasound, CT scan, or cystoscopy may be conducted to evaluate the urinary tract for any structural abnormalities, obstructions, or complications. What is treatment for UTI? Here are some key points regarding the treatment of UTIs, which include antibiotics. Most UTIs are caused by bacteria, and antibiotics are the primary treatment. Commonly prescribed antibiotics for UTIs include trimethoprim, sulfamethoxazole, nitrofurantoin, ciprofloxacin, and fosfomycin. Course of treatment. The duration of antibiotic treatment for UTIs is typically 3 to 7 days. It is essential to complete the full course of antibiotics, so that it reduces the risk of recurrent infection or bacterial resistance. Fluid intake. Drinking plenty of water and staying well hydrated can help flush out bacteria from the urinary tract and promote healing. It is generally recommended to drink at least 8 glasses of water per day during a UTI. How to prevent UTI? Preventing urinary tract infections, UTIs, involves adopting certain lifestyle habits. Here are some preventive measures to consider. Hydration. Drink an adequate amount of water throughout the day to promote frequent urination. This helps flush out bacteria from the urinary tract and reduces the risk of infection. Aim for at least 8 glasses of water per day. Proper hygiene. Practice good hygiene to minimize the risk of UTI. Wipe from front to back after using the toilet to prevent bacteria from the anal area to reaching the urethra. Clean the genital area thoroughly and regularly, especially before and after sexual activity, and avoid using harsh soaps, douches, or feminine hygiene sprays that may disrupt the natural balance of bacteria in the genital area. Urinate regularly. Don't hold in urine for extended periods. Emptying the bladder regularly helps flush out bacteria and prevents their accumulation in the urinary tract. Urinate shortly after sexual intercourse to help flush out any bacteria that may have entered the urethra. Maintain good sexual health. Practice safe sexual habits to reduce the risk of UTIs. This includes using condoms, engaging in proper lubrication, and maintaining open communication with sexual partners about sexual health. Wear breathable underwear. Choose underwear made of breathable fabrics, such as cotton, which allow air circulation and minimize moisture retention. Avoid tight-fitting underwear and pants, as they can create a warm and moist environment that promotes bacterial growth. Avoid irritants. Avoid substances that may irritate the urinary tract, such as caffeine, alcohol, spicy foods, and carbonated drinks. These can potentially worsen UTI symptoms. Consider probiotics. Probiotics, especially those containing lactobacillus strains, may help maintain a healthy balance of bacteria in the urinary and genital areas. Stay active and maintain a healthy diet. Regular physical activity and a balanced diet can contribute to overall health and strengthen the immune system, which may help prevent UTIs. Conclusion. And that's it for today's video on UTIs. Remember, UTIs are common, but they can be effectively treated and prevented with the right knowledge and actions. If you found this video helpful, give it a thumbs up and share it with your friends who might benefit from this information. And, as always, don't forget to subscribe to our channel for more health-related content. Stay healthy and take care of yourself. See you in the next video.